saya nak just tanya, this morning actually I'm going to go back to the teams. We have until the break nanti. I want the teams to share semalam ni what was your identify and define punya issue. Okay. But before I go further, for the sake of discussion, because malam masa lepas discussion dengan group 1 dengan Dr. Mac dan team apa semua, I was trying to incubate and trying to think of how to explain this better. Okay. So can I ask a few questions to group 1 or anyone in the room to share? Okay. So Dr. Mac and team, okay, HIS ni is already an existing system dalam MOH ke?
Betul.
It's already an existing system. Alright. So it has it proven dia punya worth in terms of making data more integrated?
Yes.
Making patient punya records more accessible. Yes?
Yes.
Ya, betul Encik Nairul.
Okay. So and where in places where they dah implemented, all right, what you can see is an improvement in your patient punya care lah, betul?
Betul.
True.
Alright, so this is all proven already lah. That means you have shorter waiting time, clearer data extraction dan sebagainya, betul? Yeah.
Yeah,
okay.
correct.
Alright. Okay, so macam saya kata, saya try to go back yesterday and trying to identify macam mana saya nak explain this. So okay, kalau saya nak look, if you look at the on the slide ni, alright. So let's say you identify, define, explore, action, and look back. Okay. So when we are looking at a problem, sometimes it's the way kita punya frame, how we frame our questions. Okay, macam teka tadi lah. Okay. How we frame our question sometimes membawa kepada probability ataupun action yang berlainan lah. Okay. So just bear with me. Katakan saya look at this problem dan saya kata at this point in time, katakan pada masa ini HIS belum exist. Alright. Let's say HIS belum exist and my problem is I have a problem is inefficiency of hospital systems, long waiting time. Okay, let's say that was my problem statement at the start. Inefficiency of hospital systems and we have a long waiting time. Okay, so bila I define the problem, I'm going to define the problem by saying, okay, one of it is data not integrated, reliance on manual data and filing. Okay, so that means susah kita nak extract data, susah kita nak coordinate dan sebagainya. Okay, this is on assumption that HIS belum exist. Okay, now bila kita ada definition yang macam tu, then kita akan look at, bila kita explore the problem tu, then kita akan tengok develop a centralized system with integration. So katakan HIS.
Encik Karil, sorry, tak berapa dengar suara Encik Karil.
Tak berapa dengar. Sekarang dengar?
Boleh dengar, cuma dia suara kadang-kadang dia slow sikit.
Sayup sikit.
Kena dekatkan mic kot.
Kena beli mic baru ni.
Dr. Faiz itu?
Tahulah baru beli.
Baru. Oh. Okay, sekarang okey tak? Okey, sayup.
Okey.
Okay, saya kena pegang dekat sikit lah. Dia kena jadi manual punya mic. Okay. So kalau ada gangguan lagi cakap ya. Please explain ya. Alright. So tadi, okay, let me summarize balik. So dalam saya nak bagi jelas ni. Okay, contoh katakan HIS belum exist. So kalau your problem statement is you kata you have an inefficiency of hospital punya system of long waiting time. And then you kata this is cause, the definition is data not integrated and reliance on manual data and filing. So bila you explore you punya options, apa you punya solutions ni, you can kata develop a centralized system with integration. So HIS dilahirkan lah. Okay. Now seterusnya you kata action dia, for us to know whether this is working or not, kita akan apply at target hospitals and clinic. So bila you apply at target hospitals and clinic, you tengok, okay, when you look back, okay, tadi soalan saya, is it an efficient system? Does it improve the things that you wanted to work out? So the jawapan is yes, it works. Okay. So now what are the gaps in the system and how can this be implemented in all hospital and clinics plus standardization? Okay. So ni kalau katakan HIS belum ada, this will be what I think the ideal punya boxes should be. Okay. Tapi now because HIS dah sedia ada, you are looking at improving. Sekejap lah, saya slide ni tak nampak kat atas. Saya baca from the other screen. Okay. Improving public healthcare services through health information system standardization. Okay. So this is kena dengan what we say. Okay, so what we say here, when you look back, sebenarnya you are saying that okay, HIS works, tapi now how can we fully integrate kepada all hospitals? Okay, so when you look back at this one, then you can go back to your identify this. HIS is not fully implemented in hospitals. Definition dia kenapa? Is it because of budget allocation? Is it because of infrastructure? Is it because of insufficient training of personnel? Okay, so when you have this, then barulah kita nampak where is the digital leadership punya application dengan changing paradigms can be applied. Okay, Dr. Mac? Dr. Mac and team? I'm just trying to figure out sebab semalam I saw these words macam you kata data not integrated, reliance on manual data as your problem statement, alright, your definition, okay? Tapi that one has already been solved by HIS and HIS already exists, okay? So the problem now is how do we fully implement HIS? Okay, when you say standardization, what is it yang you mean by this, Timon? Standardization ni apa dia?
Dia saya cuba kami
Ya,
semalam bincang ada a few lah, antaranya selain daripada HIS kita ada juga sistem lain tau yang exist. Kalau tak silap saya semalam kita discuss ada MPs and then dekat kita ada juga satu lagi sistem TPCO OCIS dua
TPC OCIS.
TPC OCIS So itu adalah salah satu yang standard. Yang kedua, kalau HIS ni nak diimplementkan, dia kena communicate dengan existing system yang ada dekat hospital. Contoh Makmal dia pakai sistem LIS. X-ray dia ada sistem dia. And then farmasi pun ada sistem dia. So dia kena communicate dengan sistem yang ada ni. Maafkan saya, betulkan saya kalau saya salah, Cik Fairuz mungkin lebih tahu.
Okay, so I think kalau you all agree, this is going to be what you are going to work on lah in terms of solutions. Alright, so you basically have dah kena tepat lah tu penerosakan. Sebab now kita punya idea is kalau we have all these different systems, kita nak integrate all of these different systems. Kenapa perlu different system? So now HIS ni dia kena go back to kalau you want it to be the premier, okay, you kena define then terlalu banyak sistem yang not integrated balik, alright? So what is it that you want to do at this define punya stage ni in terms of your problem statement? Okay, does that help group 1?
Yes, Dr.
Okay, okay, you bear with me, just keep this in mind sebab nanti bila kita punya next session ni kita akan look at the root cause analysis, then dia akan nampak lebih jelas lah, alright? Sebab apa kalau you ambil nanti saya akan explain masa root cause punya analysis ni, tapi kalau kita tak kena tepat in terms of identifying and defining kita punya problem tu, then we are going back in a loop, so it will never be completed. So contoh kalau kata your identify is ataupun your definition is data not integrated. Bila you explore, you already have HIS. You nak you nak integrate HIS with the other systems kat sini. Yang tu pun boleh juga kalau if that's what you want to do lah, alright? Tapi you kena tanyalah, then you you kena apply the next methodology. So I'm just giving you a few options. Keep that in mind, so that we can carry on with the application of the ideal punya methodology ni. Okay, so I will share this on the WhatsApp group, this slide. Nanti you all can have a look at it masa your discussion. Okay, group 1, alright?
Okay,
So sorry,
yes.
so semalam saya tak jelas sangat. So semalam saya balik, saya incubation period baru dapat trying to put it into a clearer picture. Alright. Okay. So now I'm going to stop share. I'm going to pass on to let's go by sequence lah. So semalam stop dengan group 1. So can I have group 2 to share your identity and identify and definition of your project with digital leadership and changing paradigms as your anchor. Yeah. Apa group 2?
Saya je Aaron. Saya
Podcaster. Alright.
Dr. Hafiza lagi siapa? Dr. Nurin.
Okay.
Saya share.
Alright, boleh.
Ni boleh tengok ke?
Boleh, boleh.
Boleh nampak Okay. Nak saya present ke Dr. Hafiza and the rest?
Okay, boleh setuju.
Okay,
Boleh.
sama lah tolong bantu
Okay, boleh.
Assalamualaikum and very good morning semua. Okay, untuk group 2 kami pilih tajuk J, iaitu resolving the issue of long waiting time for the public healthcare services. So to identify the issues adalah long waiting time. So kita ada buat narrative sikit lah. Waiting time can be defined as the time a patient waits in the clinic before being seen by one of the medical staff. The expected waiting time might differ from one center to another. According to the standard operating procedure set by the Ministry of Health Malaysia, an acceptable waiting time in primary care clinic in Malaysia is 30 minutes. So current waiting time, yes, more than 30 minutes. And then on the define, we go for the concept of 3P, place, people, and the process. So the first one is about the shortage of healthcare staff. Okay, example, long queues caused by the registration counter being managed by one staff member. And the other one is about high patient load, increased number of patients due to increased health awareness. And then the low IT literacy, this is about the elderly main problem. And then seterusnya adalah unlinked healthcare or patient data within atau interfacilities. Ni macam yang group 1 mention tadi lah. HIS, dia tak bercakap dengan TPCO cheats, dia tak bercakap dengan LIS. And then saya difahamkan pun sekarang memang MOH tengah workout for this. Even GPs pun akan boleh tengok data yang ada di public facilities lah. And then the last one on define adalah saturated population with insufficient facilities. Ini kita fokus pada urban area health clinics. Definitely facing an overcrowding issue due to the high number of population in the area. So memang kita work out sampai define sajalah. Sekian daripada group 2. Kalau ada apa-apa nak tambah, team member.
I think this works. Okay, kalau you ask my opinion. Okay, unless you want to, I think in terms of this methodology ni, this definition work. Okay. Cuma my question is kat mana yang you look at digital leadership dengan changing paradigms ni? Where do you think this one will come in terms of digital leadership dengan changing paradigm?
Kita belum buat lagi kan? Belum add lagi.
Belum. Okay, that means okay, bear that in mind sebab yang tu mungkin nanti akan di applicable semasa you look at solutions dan sebagainya lah. Alright. So untuk you have a clear definition of what you want to solve. Alright. Ataupun what is causing the problem. Okay, yang itu yang kita nak. So the problem tadi, the first slide is just the huraian you. Okay. To give a little bit more depth. Tapi kalau your statement is just kata long waiting times. Itu saja. Okay. That's your problem. Okay. And then your definition of it is there are 4 or 5 points yang tadi tu, that one will work lah. Okay. So okay, very good. This is apa concise. This is apa yang kita nak tengok sebab then each one of that line, katakan shortage of healthcare staff, high patient load, low IT literacy, unlinked saturated population, yang ni memang apa fakta yang menyebabkan long waiting time. Then kita akan tengok apa the next step yang kita akan buat ni in terms of nak cari root cause dia. Okay, alright. Thank you group 2. Very good.
Thank you. Jerry.
Sikit problem statement sikit sekejap je.
Okay.
First, second slide tu. Okay. Thank you.
Uh,
Alah, you tak ada dah masalah tu. Dr. Farhin. You duduk private. Apa you sibuk? Sorry. Saya ingatkan mic tutup. Sorry, Dr. Farhin. Alright, okay. Group 3. Group 3 siapa?
Jerry.
Jerry ya. Saya rindu lah tengok muka ni Khairul Nizam. Mana dia? Dia menyorok di sebalik avatar ni. Oh.
Aduh.
Aduh, dia orang ni selalu glamour, big boss punya geng. Okay.
Okay, Dr. Shazni, macam mana? Okay lah, okay. Okay, Assalamualaikum. Actually, diorang ni dah pakat-pakat dah for the group. So, sebab dia nak rebrand balik the group tu because before dia nampak kata agak maskulin lah. So, tiba-tiba kali ni diorang pergi bagi nama pula lah. Geng-geng mafia ni dia bagi nama jadi Baby Queen. So, memandangkan saya memenuhi lah kumpulan demokrasi kan. So, kali ni kita feminine sikit lah. So, kita bersabar je lah. Dengan apa kita kata yang baby dalam ni lah. Kita orang queen 3 orang. Ada 4 baby dalam ni. Okay, so itu yang kita ni lah. Alright, so our group kita pilih is overcoming resistance, improving digital literacy among medical practitioner. So itu adalah dia punya tajuk. So I hope our members, baby-baby semua nanti tolong tengok kan if boleh nak tambah.
Sorry, one question. Yang tu is coming from the list kan? This is
Ya,
exactly
betul.
as per the list. Alright, okay. Wow. Alright, nice. Okay.
Ya, memang redha ya. Okay, so resistant to change. So kita identify our daripada tajuk yang kita pilih tu, kita nampak ada 2 benda lah, resistant to change dan juga structural punya issue. So apa dia resistant to change yang kita identify on the problem statement is fear of change lah. Coupled with the concern how digital tools might disrupt established routine, hinder the willingness of medical professional to embrace digital literacy and improvement. So as kita kata on kita punya on issue on the digital lah. So the second is perceived complexity. The perception that digital tools are overly complex and challenging to use discourage the medical practitioners from incorporating them into their daily practices. So this is the what we identify. So number 3 adalah inadequate training, insufficient training and support system fail to equip medical practitioner with the necessary skill and confidence to effectively use digital tool. So kat sini yang kita nampak on the identify the resistance to change and the definition of it lah. So one is fear of change, perceived complexity dia rasa. Dan ketiga tadi Jero, please go back. Okay, dan 3 inadequate training. So this is the first one. We identify is the resistance to change, the problem lah. Okay, the second one is next. Okay, the organizational culture. So daripada organizational culture kita identify is the conservative versus digital healthcare system. So current system using both its availability dia adalah whether they have conservative and also digital system. So subsequently giving option to the medical practitioner means that they will have a choice to make. So kadang-kadang bila dia nak cepat, so they say yang konservatif pun ada, the manual masih ada. So since they are perceived tadi bermasalah untuk dia nak berubah, so they akan still use the conservative punya way lah. Okay, because they have option. So and then the workplace dynamic itu antara isu yang kita nampak, which is the younger employees may be more adept at using digital tools to form remote work and online collaboration as compared to older generation. So this is kita kata why all the issue lah when they become overcoming the resistance. Okay, so this is the yang kita identify. I hope group saya if ada yang nak tambah.
Okay, can we go back to the gambar baby queen tu kat depan? Alright,
Okay.
so this is your topic, overcoming resistance and improving digital literacy amongst medical practitioners. Alright, okay, that's your topic. Now go to your second slide. So you said that your problem statement,
Identify.
okay, your identify itu is first is resistance to change.
Yeah.
Okay, alright. So the resistance to change ni, kalau you ask my opinion, it has, okay, the problem statement has to be, what is the impact of not doing what you say dalam topik you yang pertama tu. Alright. So there must be a cause and effect. So katakan the fear of change apa semua ni is correct. Okay, I see tapi if you resist to change ni, apa dia yang, what problems will it cause?
You mean the result, Encik Khairil? I mean the
Okay,
effect.
kalau I
the
tanya
resistance.
sekarang ni, I reframe my question. Okay, Dr. Shaz, kalau we don't change, what's happening? Do we lose out anything?
Oh.
Okay. No, you guys are on the right track. Cuma I'm trying to say, when you identify your problem statement tu, it must have a cause and effect lah. Alright. So
Okay.
if you don't change, what's going to be the cost to you? Okay, for the future. Alright, you're going to katakan medical records will be obsolete. Ataupun it has an impact on the advancement of new medical knowledge coming into the system, because we fail to get on board the digital punya network, or utilizing this on time caring for patients apa semua, so that is the cost of not doing. All right. So the definition though is the reason why these things we are losing out is because of fear of change, perceived complexity. Okay, so yang 1, 2, 3 ni dah betul lah. Alright, no problem with that. Alright. So these are things that you can work on. Tapi cuma when you say it's a problem, because then I will ask you, so if I don't change, what is it going to be? Resistance to change. You just want us to change for the sake of changing. I'm just giving you an example lah, kan? Okay.
So, Cik
Yeah.
Clara, kalau saya just to clear my mind lah. So, is it what I understand is macam kalau the problem statement is when we say resistant to change and how it gives impact on efficiency and innovation and the organization goal tu boleh ke? Maksudnya kita just generalize, not on medical punya data ke, but we say on the bigger punya aspect lah, the efficiency, innovation and the macam organization goal. Maksudnya kalau dia resist to change, dia akan beri kesan kepada kita kata matlamat organisasi dan efficiency of the organization as general as that. Boleh?
Yes, boleh. Because you must have an anchoring punya reason to move lah. Alright. So kalau you kata we need to change, then people say, why do I need to change? Alright. So is it a policy punya change? Is it something yang we have to? Kalau tidak, then you will have all this resistance lah. So I don't really see a need to change. Tapi kalau it's a policy move and then kita punya budget, the whole of kita punya approach is going towards digitalization. Tapi people are slow because you have this fear of change, perceived complexity, inadequate training, then that becomes a real problem. Alright. Tapi kalau it's just an initiative that you want to do but nobody else is on board, then that's what we are going to challenge lah. Alright. So kalau sorry.
So adakah itu yang dikatakan macam we can relate to the paradigm shift tu? I mean when cause and effect tu kita relate dengan we want to have the paradigm shift yang kita cakap semalam tu.
Alright, interesting. So you go to your third slide. Go to your third slide. Okay, now organizational culture, the same thing that I'm going to ask you. Why do you mean by organizational culture? Because to you it might seem macam it's bad, but to me I'm okay with it because I'm at the top, or I'm not affected by it in any way, ataupun I'm too far out, my orbit is Pluto lah. Okay, Neptune dengan Pluto. So I peduli apa, what's happening dekat Mars or Venus, closer to the center. Alright, so when you talk about organizational culture, what is the problem with organizational culture that you're talking about?
Yang saya faham Cik Khairil, apa tu yang kita lihat efek tu kepada apa kita panggil digital literacy tu among medical practitioner tu, yang tu yang saya faham lah. So that's why kita kata that's why kita bawa yang organizational punya culture ni adalah salah satu problem kenapa kita still ada lagi masalah apa digital literacy among medical practitioner tu. Yang tu yang saya faham lah.
Okay, then that means you're on the right track. Cumanya now the organizational culture becomes your definition. Your problem statement is how to improve digital literacy in the hospital to meet the new challenges. Okay, so it's just the way you reframe your question lah. Okay, sebab apa kalau you put it as a problem, organizational culture is a problem. It's no. Organizational culture is a definition of the problem of not being able to increase digital literacy among medical practitioners.
Yeah, I opted
Yeah.
the second one. Yes.
Okay.
So as you want, if you want to solve the problem of digital literacy, then we have to look at how do we shift kita punya organizational culture by shifting paradigms. All right,
Yes,
of
understood.
looking at conservative versus digital workplace
yeah.
dynamics. Then all of this comes into play lah. Then baru
Yes,
kita
yes.
boleh apply this lah. Okay.
Understood.
So you guys
Understood.
got everything down there. Just macam saya kata, this is very important. The framing tu saja. Sebab kalau framing lari, then kita we might go in circles and we might not hit the exact punya target lah. Okay.
Understood.
All right. All right. Thank you,
Thank you.
group 3.
Thank
Okay,
you. Thank you so
you have
much.
something solid to work on. Okay. Okay. So group 3 now, right? Sorry, group 4. All right, group 4.
I'll share the screen. Sekejap, eh.
Okay.
Sekejap, baru first time nak share. Dia lambat. Sekejap.
Okay, tak apa.
Setting sekejap, eh.
Sentul memang macam tu.
Tak.
Puncak sentul. Baik saya duduk kat puncak pucung.
Oh, okay. Can everybody see?
Yes, boleh nampak.
Okay. So basically, our topic is bullying in the public healthcare service. Is it really a reality or a myth? Okay. Dekat presentation ni kita tak fokus lagi on digital leadership, but a bit of changing paradigm as well. Okay. Okay, so our problem statement is bullying in public healthcare service is on the rise and is now recognized as a serious emerging issue. However, there are insights that majority of the population, including those from the healthcare service itself, are not aware of its existence and implications of this issue. Hence, we actually want to provide the definition and of course later on the implications. So how to identify bullying or the act of bullying? It's actually a repeated behavior with an intentional harm and always occur when there's imbalance of power, and of course to identify the types of bullying and the impact on the victim. So we have this definition by type where bullying is actually an umbrella term to comprise these 5 different subtypes. So there are it consists of verbal abuse, physical intimidation, psychological or emotional abuse, whether there's any exclusion or isolation issues, and also sabotage. So that's our definitions for now.
Okay. Can you hear? You guys hear me? I just unmuted. Just testing. Okay, can you go back to your first slide?
Yeah. How do I do that?
Go back. Yeah. All right. So bullying in the public healthcare service, a reality or myth? Okay. So right off the bat, your problem statement yang you want to identify, what is the cause, or cause as in CAUSE? Okay. What has bullying in the public healthcare service ni caused the health punya industry ni? Okay. So one of it is how is it impacting your industry? Mental health, brain, people leaving the profession, all right, complaints, dissatisfaction because of inaction not being taken. Okay, so kalau you go to your identify, second slide. Okay, your problem statement ni, all right. The number of doctors punya retention is on a decrease or something, you know, that is caused by the bullying in the workplace ni. All right, you have data and facts to support your statement, why this, whether it's a reality or a myth. Okay, so you have to go back to that as your what do you call it, the problem statement tu sama macam group 3 tadi. Alright, you're on the right track. Cuma is where you place the identifying tu saja. So what you must say is in your problem statement tu, data is showing that, you know, there is a decrease in retention of doctors. Complaints have increased, and the mental health issues are also increasing. Okay, which is causing MOH to lose a lot of talents. All right, so that's your problem statement. So definition there is, if you go to the next slide.
Sekejap, sorry.
17 slide ni, bahaya ni.
Tak, lain tu template je.
Okay, so when you identify, actually, how do you identify the definition there of bullying ni? Okay, where are you going to anchor it? Okay, the next slide, please. Kalau I tengok. Okay, so how are you going to orang kata apa? Justify these claims? Kata there is verbal abuse, physical intimidation, psychological and emotional abuse. Alright, then you go back to data. Alright.
Yes.
Complaints about verbal abuse, physical intimidation has increase semua ni. Okay, so you have the identifying the problem statement, okay, saying that this has a cost and costing the MOH, all right, brain drain semua. So there is a problem that you want to solve there, all right. In order for you to retain doctors, to have a better workplace, better mental health semua ni, all right, you have to solve this problem of bullying at the workplace. Okay, the definition by type is, then you justify by saying that, okay, we have an increase in through the experience of coming doctors pun survey that has shown, you know, that verbal abuse is very common at the at the workplace. Okay, physical intimidations, psychological and emotional abuse, exclusion and isolation, and sabotage. You guys follow what I'm trying to say?
Yes.
Yeah. Okay, then it becomes lebih jelas lah in terms of your identifying what's the problem. That means it has a cost of you. Kalau you don't solve this, this is what's going to happen. All right, and the definition of it is described by these actions. Okay, the verbal abuse, and this is supported by what data? Okay, the data of reports being received. Again, something yang ada impact, you know, on the overall ministry punya retention ke apa. You find that angle. Okay, then baru again when you are trying to solve this problem ni, baru dia ada value to it lah. Then people will say, okay, let's do this, because if we don't do this, this is what's going to happen. All right, mental health people are going to suffer. People yang healthy, strong pun, they can take at the most 5 years. Lepas 5 years dia belah. Kalau tidak pun dia baru saja, dia masuk TDP, lepas tu kat TDP pun dia dah keluar. Okay, something like that lah. Right?
Terasa pula.
Saya tak ada masukkan siapa-siapa. Saya just saya nampak realiti.
Saya happy dekat as a doctor, happy je, hospital best.
Happy di mulut je Dr. Syal kan, cakap je kan.
Ya, betul.
Ya, dia di mana bumi dia berpijak hari ni kita tak tahulah kan. Okay. Tapi you guys clear? You see what I'm trying to say? Okay, so you guys have it down, cuma tidy up a little bit saja, the identifying and the definition tu, so that it doesn't get muddied up, right? So your first slide, your second slide tadi tu, the identify tu is just part of what you second, the third, sorry. Yang identify ni is part of your definition saja. Okay, it's not really the identify. The identify tu must be what is the problem now yang existing ni. Okay, yang can be proven through data, through statistics, through reports, through interviews of the doctors yang you have met. Okay.
Cik Farid, maksudnya kalau define tu maksudnya boleh cakap macam numbers of suicidal macam tu ke?
Boleh? Boleh.
Macam yang quit, numbers of doctors quitting tu jatuh bawah defining the problem lah.
Correct. So because you remember when I told you, dalam kita punya process of problem solving, all right, the first part must be analytical. Analytical has to be data driven. It has to be numbers. Okay, it has to be proven that it is something yang you can work on. Okay, kalau tidak, then it becomes assumptions. Right, so we cannot solve based on assumptions. Right, we have to solve based on data or something yang we have a point A and then we improve to point B. We can see the difference in terms of what improvements that we have made and we can measure. Okay?
All right. Thank you
Jelas,
very
ya?
much. Yeah.
All right. Okay. So no worry, lagi you will have time to just tidy up. Okay. But you guys have it. For group 1, I put on the slide yang tadi kita discuss tu. So you may or may not take that as your basis. Kalau tidak, kalau you have another idea pun, let's go with it. Okay. There's no right or wrong. Cuma I'm trying to emphasize the importance of really identifying and put the correct definition. Then baru kita boleh move on in solving or giving effective solutions nanti. Alright. And remember, all of this that we are doing ni, we are just applying methodology saja. Alright. This is not really doing the actual work. Tapi I want you to go with the process tu. The process is very important. But in problem solving, kalau you don't follow the process betul-betul, then that's where we have a lot of mistakes being made in terms of the solutions yang kita want to offer. Alright. Alright. So see what we have.